everyone. Welcome to this TechNet webinar. We are the mSupply Foundation, and we're going to present how the product mSupply can help with a COVID-19 vaccine rollout. And we have a particular focus on a country case study, which is Tonga. I am a consultant from the mSupply Foundation. My name is Adam. We also have Richard, who is also a consultant from the mSupply Foundation. We have Craig, who is the founder of the mSupply Foundation, on my right. And also joining us, we have Nancy, who is a digital supply chain officer, and Georgia, who works in public health in Tonga. So I'm going to kick this off. The format of the webinar is this. We're going to have a 5-minute introduction, which is going to be a very brief overview of mSupply. And then we're going to have a 15-minute demo of the mSupply toolset, followed by a case study by Nancy and Georgia in Tonga. And then we'll follow that with a Q&A session. Okay, so straight into it. Who are we? So we are the mSupply Foundation. We have a product called mSupply, which was made by Sustainable Solutions back in 2001. We're in the process of transitioning from the company Sustainable Solutions to the mSupply Foundation, which is a not-for-profit model. And we're aiming to complete that transition by the beginning of next year. Where is mSupply used? So mSupply is used all over the world. It's in over 30 countries, and it's in 5 different languages. There's a strong presence in the Pacific region. And yeah, it's the most popular logistics management information system used in low and middle income countries. Yeah, so the mSupply ecosystem has a lot of different components. The main features are, or the main parts are displayed here. The basic sort of configuration is the desktop application on the left. We also have a mobile application which runs on Android tablets, and that's open source. We have another application which runs on Android tablets called mSupply Cold Chain, and we have the dashboard, which is accessible via a browser. On the right, we have something called Amplifier Synchronization. It's not a product as such, but we've highlighted it because it's a really important feature, and that allows you to use mSupply and all the features offline. So if your internet connection goes down, you can still do all your daily operations, and then once the internet connection comes back, then all the data is synced up. On to the next bit. So straight into how the desktop application looks. This is the view you'd see on a Windows machine. There's a lot of information here, a lot of things here which are related more to LMIS systems, so not so specific to the COVID vaccine rollout. But I just wanted to give you an overview of what the product looks like on desktop. And then we built capabilities on top of that to allow handling of the vaccine rollout. So this image shows all the different kind of things that you can do, and this is a small subsection of the features that mSupply has. Next, we're going into the mobile. So the little green icon in the top means it's open source. So the idea is eventually, once we transition fully to the non-profit model, then all of our products will be open source. At the moment, most of them are, but the desktop application is still licensed. So yeah, we're in the process of that transition. So again, on the mobile side of things, there's a lot of features which are related to LMIS, and not all of them will be relevant to the COVID. But in the bottom right-hand corner, the blue and the purple highlights show things which are related to the COVID vaccination rollout. And that would be cold chain and the vaccination module. Okay, next. So this is an image of the cold chain application, which is a standalone app that runs on Android. And that can be installed on the tablet. And then you have these little Bluetooth sensors which you can buy, and you can place them in your cold storage, and then they will read the temperature of wherever you place them. They will send that data by Bluetooth to the tablet, and that tablet will display that information on the screen. You don't need any internet for that at all. It's all done by Bluetooth. And it will give you a reading in real time of the temperature. And you can set a high limit and a low limit. If the temperature goes above or below, then it will alert you that something is going wrong. Next, we have the dashboard. This is my favorite part. This is a fully customizable dashboard that has access to all the data in your system. And you can really manipulate and configure this however you want to display whatever kind of data you want. So if you have someone in the organization that has any kind of knowledge of SQL, then they can really, it's a really powerful tool. They can do whatever you want. So it's a really, really great thing to have. I talked about this briefly earlier. This is the synchronization. So on the left, we've got a situation where the internet's gone down, but all the people in the hospital in the blue can carry on doing their daily operations. And all the people in the pink in the warehouse can carry on doing their daily operations. And then on the right, when the internet connection is restored, then the data is made good between the two different sites. And this is a very sort of basic overview of our system. The brains of everything is in the yellow box in the central server. And then in the green boxes at the bottom, these are the different sites within the country which would have mSupply installed. They might be using a laptop or an Android tablet, depending on their requirements. And you can have as many of these sites as you want. Yeah, it's hard to try and illustrate that, but then all their data will sync back to the central server, and then the data in the central server can be viewed by the dashboard on the right in the purple square. And additionally, we have a patient hub on the left, which would allow someone to put data into the central server from an external source, such as a browser. Yeah. And now we're going to try and do a quick demo of mSupply. And we have a scenario for this. So the scenario is that there is a rural clinic, and they would like to vaccinate a patient that's come in. They do not have sufficient quantities of the vaccine in stock, so they're going to make an order to the central warehouse to get the vaccine. The central warehouse is going to send the vaccines to the rural facility, and while that's happening, a patient is going to go online, access the patient portal. They're going to input their patient details, and then the vaccinator at the rural clinic is going to then see the details from the patient that was input, and they're going to be able to take one of the vaccines that they were sent from the central warehouse and dispense that to the patient. And then we will go and see the dashboard and see that the figures for the overall system have been updated. So that's the hope. Let's see if it works. Okay, so first of all, what I'm going to try and show is so I'm doing everything on this Android tablet. This is a copy of mSupply Mobile. So I'm just going to log in. Okay, so right now we're logged into the mobile application. In the bottom left-hand corner, we have an area which you can look at the stock you have in your clinic. So we're going to have a look at the stock. We can see we've got one line here for AstraZeneca COVID vaccine. So we're going to have a look at that. And we currently have 59 vials, and each vial contains 10 doses, which is demonstrated by the decimal point here. So we've got 59 vials, and one vial has been opened, and there's 6 doses left. But we actually, for whatever reason, we want to request some more. So we're going to make an order to the central warehouse and say, please give us some more AstraZeneca vaccines. So here we go. We're going to do a requisition here in the top right. We're going to make a new requisition, and we're going to select a supplier, which is going to be our central facility at the top there. So we're going to choose those and hit OK. And then we are going to choose the type of thing we want to order, which is it working? Oh, that's right, thanks. That's great. We're going to choose a vaccine. Go done. And then here we've got a choice of vaccines that we're going to order, but we're going to order the AstraZeneca vaccine. So we're going to ask for them to dispense, we'll say we'll say 5,000, just so we've got plenty of stock. We'll say, okay, can you give me 5,000? And okay. And then we're going to finalize this order, which says, okay, we're happy with this order, please send it off to the central warehouse, and then they can take it from there, they can process from there. So here we go, confirm. Okay, so now the the rural clinic is now going to be sitting there waiting for the central facility to receive the order, to process it, and then send the goods back out to us. So normally there would be a sync process which happens between, if I just go back to the demo slide. So on the tablet, we're at the green box, we're one of the green boxes, and then, sorry, we're the green box, for example, site C, and then we're placing an order to maybe site B, the warehouse. It has to go via the yellow box, the central server. So to do that, it has to make a sync. So you need an internet connection to make that sync. And that does happen automatically, but we're going to try and speed the process up because it's not instantaneous. So there's a way we can do that manually. So I'm going to show you how to do it manually, just for the demo purposes. So yeah, so in here, press the top right-hand corner, and it says there's 9 records waiting to sync. So I'm going to press the sync button, and that will push all the data to the yellow server, which will then send it on to the warehouse. Okay, cool, so that's done. So now I'm going to switch to the warehouse's view. So these are the guys in the warehouse, and they're going to be looking for orders coming in from rural clinics. So if we go to requisitions, we can see at the top here there's a new order, and we're going to open that and see what they want. And they want 5,000 vials of the AstraZeneca COVID vaccine. So we're going to say, okay, yep, we'll just give you whatever you want. So we're going to say supply quantity. Oh, sorry, select the line, supply quantity, and then that should have said, it's just filled in the, so the customer's requested 5,000, and we're going to supply 5,000. And we're going to create a customer invoice for that. So here it's saying, okay, it's red because there's more than one batch of this vaccine in stock at the warehouse, and it's going to ask us, okay, which one do you want to send out? So we're going to go and have a look, and we're going to send out this. Ooh, which one? I can't remember which one we're sending. Let me just quickly check. So I want to send out a different batch to the one that's already in the rural clinic. So then see there's 2 batches. So in the rural clinic, we have, okay, that one. So I'm going to send out this top one, and 75,000. Did I do that? Oh, I need to
double click.
Double click. And it's giving me a warning that the item expires reasonably soon, but I'm just going to ignore that and send it anyway. Okay.
Just try it.
Oh, I turned up for this one.
That should be okay.
Yeah. Yeah, there you go. Okay. So then I'm going to finalize this order and send it out. And then I will finalize the requisition to say we finish with that. Okay, cool. So I'm going to switch back to the rural clinic. Yeah. And so what I'm going to do is the central warehouse has sent the order out, and we probably say we physically received the goods. And I'm just going to make the sync between the different sites so that we have the data waiting for us in the mobile application. So I'm going to do that now. So we've got one record coming. So, oh no, sorry. So in the top right hand corner, we've got an indicator saying there's something we need to action. So we're going to go and look in the supplier invoice, and they have sent us 5,000 AstraZeneca COVID vaccine vials. So we're going to say that, yeah, that's good. We're going to receive that and say that's all good. Cool. So now if we check our stock, we should have a lot more vaccines. We've got 2 different batches. You can see the batch number on the left-hand side. We've got one with 60, roughly 60 vials, and we've got one with 5,000. So now you can imagine the rural clinic is like, okay, we've got plenty of vaccines, but I want to imagine that while that was happening, there was a patient going online, and where is this gone? Here. No, I've lost my browser. I must
Number 10.
it's in here because I can't see it. Okay, so yeah, so this is the a browser that the patient could access through the internet. We made this one for Tonga. It can sort of be customized however you want to do it, really. So they are going to go into this button here. Imagine I'm a patient, and I'm going to register my details. And there's a lot of information, so I'm just going to put the minimum required information. Let's just say this is a TechNet demo patient. And the date of birth is 1st of the 1st, 1991. So you can put all kinds of information. You can put the phone number, email, address, citizenship, lots of information. They can put the ID in. You can choose the form of ID, passport. I'll put a passport number in, 1, 2, 3, 4, 5, 6. So there's all this is customizable, so you can choose, what information to include on these kind of forms. And then I'm going to submit that form. Submit. Oh, sorry, I missed a required field. Which one? Oh, the employer. Occupation, healthcare worker, employer, non-government, and the island. Submit. Okay, cool. So that form should now have been sent to the central server. And with a bit of luck, if we sync the rural clinic, they should be able to pick that data up and it'll be available for them to see in the vaccination module. So go OK to that. And we'll just switch back to the mobile app. So I'm going to sync again. Oops. Cool. So now I'm going to show what happens if someone is using mSupply to dispense a vaccination to a patient. So the vaccinator would have a tablet in front of them. They would go into the vaccination module in the bottom right, and then they can look up existing patients in the system, or they can add a new patient. I'm going to try and look up the patient we just added, and I'm hoping they'll be there. So we'll just have a look. Let's have a look. So we added. Yes, TechNet demo patient, the third one down. So we're going to choose them. So in here we can see all the information that was input by the patient, and we can also add to that and anything that's required. So I'm going to just ignore everything and go next. And now we can see the batches of the vaccine that are available to be dispensed to the patient. We have 2 lots of batches. I think I'm going to choose
That one's got the open vial.
the one with the open vial, yeah. So there's one that has 596 doses.
That's why that one's been chosen.
Yeah, and that's been highlighted. So we have a vaccinator in the top left-hand corner. You can choose who is doing the vaccinations, and that's recorded. There's a few other features, such as if the patient refuses a vaccine, then you can mark that and it's recorded. And also, some places have realized that even though the vial says it has 10 doses, they could actually scrape an 11th dose out. So we added a little feature to say that this was actually a bonus dose, and then it wouldn't decrease the amount of stock you have recorded in your system. So, and you can also check if the patient has had any previous vaccinations. So, yeah. So I'm going to choose that and say, okay, please give that patient this vaccination. And that's done. And so then if I go and check that patient's details, it will show that they have had one vaccination from the AstraZeneca COVID vaccination. Okay, so now all that's done, I'm quickly just going to show you the cold chain module. So the cold chain module will allow you to track temperatures of your cold storage locations. On the screen, you can see if there's a a green icon, it means that so each of these lines are a different sensor, a different Bluetooth sensor, and they're usually placed in different locations. So you can name them however you want. And then if they're green, everything's okay. If they're flashing orange, then something's gone wrong. So if we looked at the orange one down here, we'll get a chart of the temperature, and we can see that it, maybe a couple of hours ago, it went above the orange line, which was our higher limit, and that was a breach. So that needs some attention. So we need to, someone needs to come and look and see why the location is hotter than we anticipated. Yep, so that's a useful feature. And the final part I want to show is the dashboard. So where's the pass on this page? So the dashboard is also accessible via a browser. I just need to, the things in the way of the browser.
There's a way to hide it under more.
Oh, okay. Sorry, the Zoom control panel is hiding the browser.
2/3 of the way down.
This one.
Yeah.
Yeah. Okay, so on the other tab here, I have this browser. So this is, you have to log in to view this information, so you can restrict who can see the information. And this is just a demo dashboard that I've made myself. And so I've just configured it to say, okay, the only things I'm really interested in are the top row, so the number of patients that have been vaccinated and where the AstraZeneca COVID vaccines are located. I've got the two stores, the central facility, which is the warehouse, and the rural facility, which is my local clinic. So data from the systems is automatically sent to the dashboard every 30 minutes or so. We're looking to reduce that time to every few minutes. To speed this up, because we haven't had 30 minutes since I made the changes, I'm going to manually push the data to the dashboard. So just bear with me, I'll just go and do that quickly. You can do that in here. This is not something that a user would normally have to do. So, just takes a minute. Okay, cool. So in theory, if I refresh this page, hopefully the data will refresh. I'm hoping that 22 will turn to 23, and I'm hoping this will display differently. So let's see. Big test. Okay, so so we've got the additional patient who's been vaccinated is now showing up, and we can see that 5,000 doses have moved from the central facility to the rural facility. Yeah, that concludes my demo, I think. So I'm going to switch back to the presentation. Fantastic. And we're going to hand over to Nancy and Georgia to talk about their experience using mSupply during the COVID-19 vaccination rollout in Tonga. Thank you.
Thank you, Adam, and malo lele, everyone. I'm Nancy, and I will be talking about the use of mSupply to manage our data for COVID-19 vaccination here in Tonga. And I'll be talking about it in the process of patient registration, stock management, vaccination, and the dashboard. With our patient registration, or what Adam was talking about, the dispensing module. Just before the launch of this vaccination, our communication team had several media appearances, and through these, the public was advised and given a link to register using the online registration form that Adam had shown earlier. And for those that could not access the form, could come in with any form of valid IT to any of our vaccination site to be registered in which we had student nurses that was given the responsibility of the patient registration. We didn't have much time to train our public health staff in using mSupply. So we had picked the student nurses to do this as they were younger and more tech savvy. So less time that got us to train them, and they got up very fast with it. So the process with this patient registration was every time someone comes in, they would check their names against the system to see if they're in it yet. And if just to confirm the information that has been filled in, if they need to edit it. Otherwise, if it's not in the system, then they would go ahead and register as a new patient. At the end of our first dose, we had a total of 29,522 patients registered altogether, and 1,531 of those was using the online registration form. We had thought that we would have a higher intake on the online registration, but this did not work well for us for the first dose. So we decided that we'll just go ahead with registering on site with our second dose, which we started today with our rollout of the second dose. With our stock management, we had each team reporting to the EPI room by 5:30 on duty day to pack cold box, hand carriers, and to also dispense the vaccines for all 12 teams that we were using, and ensuring the teams are dispatched to their vaccine sites by 7:30 a.m. During this process, the cold chain team would work together with the pharmacy and mSupply team in dispensing the vials in the morning, and to stock take in the afternoon, just to ensure that the stock cards are well documented, and also to report to our command center at the end of the day. Also, at the end of the day, we would sit down comparing our vaccinated tally sheets against our mSupply, just to make sure that our stocks, our physical stocks, and our mSupply stock matches up. In a case that during the day that any of the teams would run out of stock, there was a team here in the hospital that would be responsible for dispensing any of the vials needed from any other team, but they would also inform the mSupply and the pharmacy team. As for our vaccination process, our command center had did the team distributions, and for our first dose, we had 6 teams that consist of 2 supervisors. These 2 supervisors were also responsible for taking care of our cold chains out on site. We had 1 pharmacist that was responsible for dispensing and also counseling if need be with anyone that comes in for vaccination. Our 3 student nurses were responsible for registration. So they were the one that was using mSupply throughout this whole campaign. We had 4 vaccinators and 3 clinical nurses that was responsible for the holding area, and 1 M&E officer to overlook the data and also take care of the devices, of the mSupply devices out on site. We had 3 mobile teams that consist of 1 vaccinator, 1 student nurse, and a clinical nurse that was established to reach out for people with disabilities and any elderly that could not make it in, they could not come into any of our vaccination sites. 3 doctors were also assigned to make rounds on the teams and check up or be on call for any AEFI case. The number vaccinated varies daily, depending on where they were stationed at. We had a few districts with a lot more people than other districts, or some days that the previous district could not make it, and majority of them will come to the next district that we moved into. So by the end of our first dose, we have vaccinated 28,667 people. Towards the end of our first rollout, a few more mobile teams was included as we were closing in on the expiry date. And we managed to collect a lot more numbers and vaccinate a lot more numbers from people that lives out of town, lives in farms that could not make it to our vaccination sites. We had also found that when we had moved out from the city and did vaccination out in the community, we had higher number of people, as our target population was were the elderly, and majority of them did not work, and so they were not in the city and not working, so they're mostly out in the village and at home. And for the dashboard, like Adam, this is our favorite part of mSupply, is the dashboard. Our command center and our key decision makers had loved sitting and watching this part of mSupply throughout the day. They could monitor our level of stocks, the activity of each team, tally counts in stocks, in number of vaccinated people. And the map overlay was also a favorite part, watching how we have moved through districts and the work that has been done. Every end of the day, decisions were much more easier to make, as they had received live data. And with this decision, they would, for example, with this data, for example, they would make decisions as they look at it and see if any of the team is a bit quiet or not vaccinating people in, they would call in to either move to another spot or to send them home for the day if it's not worth staying the rest of the day in it. Just a little summary on our experience with mSupply. We using mSupply for COVID-19 vaccination rollout here in Tonga has really changed a lot of perspectives and mindsets towards using a computerized system to help with our daily routines and decision making. The immunization in Tonga has always been recorded on registry books and relying mostly on immunization cards for patient histories. So Tonga using mSupply was a really big step. And the system was new, but it was also interesting for them to see how this worked. a few improvements from our experience was that we could not view patient history across the tablets or the stores. And thanks to the mSupply team, this has been fixed, and we are super excited to use this, and it had worked amazing today. We managed to view everyone that come in to view the history. Same as the cold chain. We have started using the cold chain as well. It works amazing. They can monitor it through the dashboards as well. And yes, all in all, this mSupply has done very well for Tonga's rollout. And we're excited to continue using mSupply, hopefully with the rest of our vaccines. Thank you.
Thanks, Nancy and Georgia. That was great. Okay, so we've now reached the questions and answers stage. I'm going to ask Rashad, who has been looking at the questions that have been coming through on the chat, and he is going to direct the questions to either Craig for mSupply related questions or to Nancy and Georgia for Tonga related questions. Okay, over to you, Rashad.
Thank you, Adam. Thank you, Georgia and Nancy. Thank you, everyone. So, yeah, Alex, there's the first question from Melaku, and he's asking if we're going to send additional documents after the webinar. I think that's what you usually do, right? You're sending the presentation to. But yeah, we are obviously happy to send documentation about vaccines and cold chain in English or in French. So there's no problem with that.
Richard?
Second, yeah.
Sorry, this is Alex from TechNet. Maybe a possibility would be that I'm going to send an email to all the people who registered. I can link all the, I can provide all the links to download the documents or attach them. We can discuss that, and so that they can receive all the documents in English et aussi en français, because it seems like some people were asking in French as well.
So we have another questions. So that's probably going to be for Nancy and Georgia. So Dorothy is asking how many devices were procured for Tonga, and how many health workers were trained for the digital solution.
36 devices. Yeah. We had set up 36 devices, tablets and keyboards. We had 10 cold chain sensors. And for our first dose, we trained about 20 student nurses, 7 pharmacists, and the 5 M&E officers for our first dose. But we, the second dose, we continued to train a lot more reproductive health nurses and community health nurses, as they had reshuffled the teams around, and our clinical nurses were taken back into to inside the hospital. So more people were trained for the second dose.
I think it was about 60 people altogether for training for our second dose. I think one of the lessons learned was we wanted to make sure that everyone who was at the vaccine site knew how to use mSupply and knew how to use the tablets, so that everyone can do all the different jobs at the vaccine site. So that's our thinking in training all the extra people, and yeah, I think it'll work really well.
Good. Thank you both. Next question is there's actually 2 questions that are almost the same. So based on your COVID-19 experience, do you consider rolling out the routine using mSupply for the routine immunization, so for other vaccines?
Do you want to start? So mSupply has been really successful. Everyone's been really happy with it here in Tonga. And so I think our plan we have another immunization rollout of a few new vaccines that will be starting in about August. So the plan is to keep using mSupply. One of the big benefits that we see in that is that we will be able to hopefully have quite a comprehensive vaccine history for people if we've got it all in the one system. And we'll also be able to track our stock as well, which is a huge benefit of it, is that we can track the stock within our hospital and within our facilities when we go out to schools as well, when we go mobile. So yes, we're hoping to use it for all of our new vaccines coming in.
Okay. There's a lot of questions about integration, and a specific question about, is mSupply able, are we able to integrate mSupply with other systems like a civil registration? And we actually have a good case in Vanuatu right now, where we have we have created a possibility to scan a QR code to link the national ID card of Vanuatu citizen to the patient data in mSupply. So I guess there's many things that we can do as soon as obviously we have access to the API to create the integration between the two systems. So
Or at a more simple level, also, if there's a like national census data, we can import that data into the system from Excel or a text file or whatever.
I have next question is going to be about the overall budget. So maybe a few words about the costing and.
Sure. mSupply Mobile is open source and free. The New Zealand government very kindly paid for the modifications to the software to make it appropriate for use with this COVID vaccination campaign. At the moment, our desktop software is for Tonga, the cost would have been a few $1,000s, between $5,000 and $10,000 altogether to set up the system and to host that in the cloud. So that's a one-off cost for the software licenses, and the cloud hosting is around $200 US a month, so relatively cheap. You can also host the system on premises, so countries that have strict rules around that, there's no problem with running it in a local data center in the Ministry of Health.
Okay, so I have another question. Somebody said that they are working with the Senegal EPI and they are using Logistimo, and that person is wondering if it's a similar app. I don't know about Logistimo. Maybe you do, Craig, or
we know a little bit. I think en français, if it's Senegal.
Yes.
So Logistimo is a very good application. I think one of the I'm not sure about Logistimo, but previously in its current state. But it didn't used to handle synchronization, so it didn't used to work offline. Maybe it does now, but that's one thing that mSupply has often saved us in a lot of countries, the offline mode.
Okay, so then that's all for the question in the Q&A, but we had a few questions in the chat. So maybe another question for you, Nancy and Georgia. John Pierman is asking how much time did it take to set up the whole operation, so the vaccination. So I would say from the mobile device reception to the end of the first dose rollout.
Yes.
So I think in terms of when we contacted mSupply and said, hey, we'd like to use the system, it was probably about 6 or 7 weeks, maybe less than, to when we contacted and said we want to use it to when we launched our vaccine. So the poor guys on that end, I think, got a lot of messages from us, but I was so amazed at how quickly we were able to set it up and get it running pretty seamlessly all the way through to the end of the first dose. So I think our First dose rollout was another 6 weeks. So it's about 12 to 18 weeks altogether from when we contacted mSupply, got it developed, and then to when we finished our first dose.
Thank you, Georgia. And I think we have a last question from John Pierman. Does the system require batch numbers and expiry date to be repeatedly entered on administration into patient immunization record? The answer is no. You're gonna choose the batch that you want to select for your patient, and then the system will automatically choose the batch that you previously dispensed. So unless you want to change, you will have to click to another batch, but then you can basically dispense the vaccines to 10 patients just by clicking on OK next and validate. So you don't have every time to choose your vaccines. It will by default select the one that you previously used. And obviously that's for kind of logical reasons. So we want to use open vial before moving to another batch.
And then once you've used up a vial, after that, the rule is FIFO, so first expiry. So it will automatically then pick the next batch with the shortest expiry. So for a normal dispenser, you don't do any batch choosing at all. You just hit the OK button.
I have one last minute question. Hello, thank you for your presentation. You're welcome. Does the system generate a report of all operations performed? So I guess this is kind of a log. I mean, the dashboard is already meeting most of the needs for that, as Nancy and Georgia described. Was a useful tool to know how many doses were dispensed. But then, yes, within the system, you always have what we call the log, where you can track all the operation that has been made in the system and by who. So
at a simple level, every transaction and every patient event. Actually, we didn't even touch on adverse event reporting. We have both a web-based for people not using mSupply and internal in the mobile app. There's adverse event reporting. Once again, entirely customizable for each country. Get back to your question. Yeah, every transaction has a record, and then at a lower database level, there's what you call a journal, or in SQL usually a write-ahead log that records every single operation. Thank you.
So I think that was the last question. So unless somebody is quickly typing one in, but then I will hand over to Alex for the closure.
Can I make one last final comment?
Of course.
Yeah. I think we're a technology company, but we 100% know this is about people, not about technology. We've had a wonderful team to work with in Tonga. They're committed to getting great health outcomes for the people of Tonga. We've got a wonderful team here in New Zealand, and also an office in Nepal, and some staff in other countries. And it's been a real team effort. So yeah, we're thrilled with the great result that's come from that. Thanks.
Well, thank you very much for this presentation and interesting case in Tonga. Maybe I give a last chance for last minute questions while I'm closing, so just in case there is one. But for some information before we close, this webinar was recorded, and we'll share the link to the recording as well as the presentation by email with everybody who registered. We'll add the links and maybe some contact details in this email, so that if you have any question, you can contact directly the team, and you'll also have like some additional documents as requested. We might, well, I speak with Adam and Richard because there was like some interest in French, to see if there's any interest in doing the same webinar or something similar in French. I'm sure Georgia and Nancy are looking forward to speaking French and presenting their case in French. Yes, maybe a last word. TechNet will be having other webinars on other ELMIS systems over the summer. And we hope to have the next one next month. Stay tuned. We'll keep you posted. Thank you very much. I don't see any further question, any other question. Well, thank you very much to everybody. Merci, and we're looking forward to having more interactions with you. And well, thank you very much, and have a nice evening, because it's quite late for you, you guys in Tonga and New Zealand. Merci. Have a nice day, evening, and goodbye.
Escape key. Share the screen share. Some people